Good afternoon, AP Research. So today we're going to talk about ethical and safe research practices. So I'm going to walk you through a Google slideshow that was created by the College Board. It was adapted from material the College Board used, and you're going to need this information to make sure that your research project is done ethically and responsibly. So make sure you take any notes that you might need to reference later. You can always refer back to this video or the presentation itself. So let me share my screen so we can start taking a look. All right, so our goals in this presentation are first, we're going to identify the types of inquiries that will require institutional review board approval. We talked about IRBs previously, but that is our institutional review board and how to seek that approval. We also want to be able to revise our research methods to meet ethical guidelines. So we want to make sure that we are doing everything ethically. And then employing ethical research practices, which is an overall learning objective in AP research. So let's take a look at this picture, and I'm just going to read a quote to you, and I want you to just think about this quote. So, even greater numbers of us will be asked at some point in our lives to participate in a research study. We might be invited to participate in surveys and focus groups, asked to let researchers conduct studies with our tissue or medical information, or recruited for clinical trials that test whether drugs, medical devices, or biologics, like vaccines and genetic materials, are safe or effective. One company estimated that the number of participants needed to sponsor trials grew from 2.8 million in 1999 to 19.8 million in 2005. There's also a growing need for children, the elderly, and people with certain diseases to enroll in studies that test interventions targeted to those populations. The very fact that record numbers of people are being recruited for research makes thoughtful attention to how we safeguard human subjects at the utmost importance. This was by K.G. Mashk, I'm not sure if I'm saying that correctly, in a paper, or a report rather, called Human Research Protections, Time for Regulatory Reform. So I just want you to turn to someone next to you if you're watching this in class, and I want you to just discuss the question, what does ethical research imply? So you can pause there and have a quick discussion. And I'm going to continue on. So hopefully you paused. All right, so first let's talk a little bit about the rules that go into effective research, ethical research rather. Number one, do not come in contact with or use harmful hazardous substances or organisms. So none of us are certified to use any hazardous materials, and so we're going to assure that we don't come in contact with any harmful, because the first person you're responsible for is yourself, and you want to make sure that you're not putting yourself in harm's way. Second, along those lines, is we're not going to experiment on ourselves. So we can't use ourselves as experimentation. We can't inject ourselves with any supplements to test their effectiveness. We can't see if we can live our lives without a pinky finger. That is not something we're going to do, even though it is your decision because it's your body. We're not experimenting ourselves for the sake of our research projects. That would be unethical. Do not experiment on others with anything besides surveys, focus group interviews, or questionnaires. Like I said, we are not certified researchers. We don't have the proper trainings that we would need to do any more than what these different ways of researching are. And so therefore we're limited to only doing surveys, focus group interviews, or questionnaires. So we're not experimenting on people in any other means besides those. Next, include ethics and safety measures in your methods. So when you do create your research methods section in your paper, you will want to have a discussion about the ethics that you followed and the safety measures that you put in place to assure that you followed those ethics. Next, don't collect identifiable information. And this is a tricky one because there are instances where you will need to contact individuals and store information, but we want to make sure that we remove the identifiable information. So there's a couple ways we can do that. We can code information so that it's de-identified. So instead of using names, we use numbers and some sort of coding system. We can assure that we don't publish any information that is identifiable. So if it is identifiable information, it doesn't get published in the final product, and that information stays within you, the researcher. And then at the end, we destroy all all identifiable information that was collected to assure that it doesn't accidentally get into the wrong hands, or that we aren't put in a position where we might lose it or have it taken from us or seen by others. So here's some guidelines for human subjects. And these should all be self-explanatory, but it is worth explaining because it is that important. And so number one, we respect all persons because they are individuals. They are going to be your volunteers. And remember, research is always voluntary, and they always have the right to take themselves out of the research if they would like to. And they need to be protected because we should be looking out for our fellow human beings and assuring that we're not putting them in harm's way or any discomfort. We cause no harm, so none of the things we can do can cause harm. That's physical and psychological. We want to make sure that we are causing no harm to our fellow peers or human beings that we might interact with in our research. And we want to make sure we are minimizing discrimination. And that includes giving appropriate benefits. So if we give a benefit to one person, it goes to all of them. We'll talk a little bit more about what giving benefits means and how that might skew results. So be wary of giving benefits, but if you do give to one, you give to all, and then giving equal benefits to all participants again. So making sure that we are not giving one benefit to one certain class of individual and not to the other. So more about benefits. Sorry, I'm losing my train of thought. It's common for us to pay a token amount for participants in a study. That is possible. I'm going to encourage you not to do that. And again, we'll talk more about what that might mean. It's not necessarily unethical, but it does play into your volunteerism, because someone is more likely to say yes if they do have a benefit, which now takes away that volunteerism aspect. We can talk more about that later. If money isn't offered, sometimes a gift is given instead. Again, it's a possibility, but not recommended. Benefits should not be a bribe, and that's where it gets precarious, is when a benefit seems as though it is a benefit, but really it is more of a bribe for the person. And the proposal for the research project needs to be honestly discuss any benefits to be given. So before you start anything, it can't be after the fact or last minute. It should all be part of the proposal itself. So when you go to your IRB, the discussion of the benefit will be with there if you do choose to do a benefit, which again, I am encouraging you not to. And benefits don't have to be the same for every participant, but they need to be fair. For example, adult participants may be given a gift certificate to Starbucks, but child participants may be given candy. And so it's appropriately different, not inappropriately different. Not my friends get this great benefit while the people I don't necessarily like get this other one. And we want to make sure that we are being equal with our benefits that we are providing. Some additional ethical practices. One, there's a duty to protect people's rights, privacy, and sensitivity. So we want to make sure that we are keeping up to date with our participants' permissions and securing them. So no one has to see those but yourself, to make sure that they're collected adequately, and they should be stored somewhere safe. Maintain confidentiality and anonymity. So when you are researching with them, you're not telling your friends, oh, I asked this person this question and they said this. It's not a means of gossip, it's a means of research. And so you want to make sure you're being aware of that. Do not misuse any information to discover it. So again, this is not a chance to learn more about people to use in your lunch table discussions. It's for you to find information for your research project. And to get the approval of an institutional review board, your IRB, when circumstances require it. And we'll talk more about the IRB later on. So first and foremost, I, your teacher, will be reviewing your project to ensure that it's safe and ethical. That's the first step, is I'll make sure everything is there. If you don't plan to publish your findings, that will probably be it. However, there are a couple of requirements that College Board does put into play, even if you aren't planning on publishing. One, anything that involves animals or harmful materials must be approved according to your school district policies. It's going to be very limited on the ability to use harmful materials and or animals. And that will be a discussion we have with our administration if that is something we need to discuss. But the error is on the side of not using those two means. If people are involved in your study, then the project must be approved by an IRB, an institutional review board, which again we'll talk about later. But if you are using people, that is an IRB approval, and we do have an IRB at our school that can do that approval for an expedited process. So let's talk more about what consent means. Broadly speaking, informed consent is permission granted by participants and is based on full knowledge of the possible risks and benefits. So there is a waiver from physical or psychological interactions. We must make sure that everyone agrees and that we have record of their agreement. And the waiver is very explicit. It states on the waiver what you're doing. That way there's no ambiguity of, oh, well, you didn't say that. I signed this waiver, but that's not what you told me. It's all written down and they sign what's written down. So participants are offered informed consent that asks permission, describes the experience. Again, you have to tell them what they're going to experience. There should not be any surprises. We're not putting them through any psychological challenges. Explains how the data will be used. And when minors are involved, parents must give informed consent. Remember, if there is a minor, which again, I recommend not doing anything that has to deal with minors because of all the hoops that you need to jump through, and it makes it much more difficult and it takes much more time, but it is possible to use minors as long as there is parental informed consent. So you want to make sure that you have that before you do anything. And again, that'll be pre-approved before you even get to the step of giving out permission slips. That those forms will have to be given to your IRB in the approval process. So what is an IRB? Keep using this acronym here. So according to Wikipedia, an IRB applies research ethics by reviewing the methods of research to ensure that they are ethical. The purpose of the IRB is to ensure that appropriate steps are taken to protect the rights and welfare of humans participating as subjects in a research study. An IRB also ensures that research projects follow institutional policies and governmental laws. So essentially, it is a committee that reviews and research plans involving human subjects. They're an informed committee that has knowledge of what is acceptable and unacceptable. At least one member has been approved to serve on the IRB, as in they've received a certification from a higher body on what it means to do ethical research. The reviews are done before experimentation begins, so making sure we're not getting permission after we've done it, and we're not seeking permission after we found our results. No, this is before you even start the experimental process. That includes surveys and questionnaires, professional tests, when the research is the subject. The IRB determines the level of risk allowed, and so the IRB will, if there's an issue, they'll send it back and they'll tell you what to fix and what is not approved. They'll be specific. It's not going to be general. But IRB approval will mean that the board has been reviewed the proposal and given permission for it to be conducted at an institution within the constraints set forth by the IRB and other institutional and federal requirements. Again, at least one individual in the IRB has received a training and certification on assessing those. And it's also, if any changes to the research happens while you're in the process, you need to go back and get the IRB to reapprove any changes. You can't just make a change after approval. You have to make sure any changes are also approved. So that makes it a little bit more complicated, but again, it may happen because research is not a straight line. It's a squiggly sometimes. So what constitutes a risk? Let's take a look and see. So the federal definition of risk is that no more than minimal risks exists. Possible discomfort will not be greater than what is ordinarily encountered in daily life, or discomfort will not be greater than what is experienced during routine physical or physiological examination or tests. So activities other than ordinarily encountered in daily life, making sure that it's walking up and down stairs is fine. Tripping someone walking down the stairs is not okay. So think along the lines of that. Emotional stress resulting from an incursion on a person's privacy. So we don't want to, again, psychologically or emotionally put someone through undue stress that does cause harm. So making sure we're being aware of that. Ingestion of and or physical contact with any substance. Again, harmful substances is very delicate and we should not be dealing with those. If your research requires it, that's a conversation we can have. But most of the time that conversation will end with no, find a new method in order to accomplish your goal. So who is considered at risk? Any student 21 or under doing experimentation with potential dangerous substances. Any person with a health risk, ergo disease, heart condition, pregnancy, etc. Any member of a special group covered by federal regulations, ergo prisoners, special needs persons, children, economically or educationally disadvantaged persons. So these are our at-risk categories, and notice that you as students and your peers fall within at least 2 of those categories. So making sure that we're being aware of that, that using your students and peers is, yes, convenient, but may not necessarily be simple or easy. Some typical IRB questions that you'll have to answer. So does the study gather data that identifies individuals, ergo social security numbers, names, and then your response to this should be very cut and dry, right? There should be no, and it should be clear how you avoid this in the method. Will data identifiable by individual be shared, ergo conference presentations, published articles and reports, etc.? The correct response should be a no, and it should be made clear how you're avoiding this via your methods. Are participants being offered 1 or more incentives for participation, ergo cash or gift? List the incentives. This could be a yes or no. Again, I recommend no because there are complications that come with saying yes, but it should be clear that all participants get the benefit even if leaving before the study is over. And number 4, in participation in the study, is it voluntary? And it should always be yes, and should be clear how you address this in the methods. More questions. Will participants be fully informed about the benefits? Always a yes. It should be very clear how you address this in the method. Will participants be videotaped during the project or study? This question could be a yes or no, but it should be clear that identifiable evidence is deleted and not published. Again, someone's likeness and face is part of their identifiable evidence, and so therefore you have to treat it just like you would their names if you were collecting surveys and things. And will participants be debriefed following the completion of the project? And this should be a yes. If the study asks participants to do something that might have caused stress, there needs to be some sort of debrief. So that will be a discussion we have if your methods requires that type of follow-up. Some more questions. Will participants prior to the project indicate informed consent to participate by completing and signing a written form? And that should always be a yes. And again, that is a double yes if it requires minors. Are data sources clearly identified, ergo interview responses, survey results, reports, grades, school records? And this should be a yes, and it should be clear how you address this in the method. So when making a decision, your IRB will follow some parameters. Number 1, if your project does not include, let me get all these out here first. If your project does not include human or animal subjects, then that's just a conversation you have with me. That should just be a question you discuss with me first. If it's a yes, that's where it starts getting complicated. Identify whether the study is exempt for IRB approval. There are some exemptions where you don't have to get IRB approval. So one would be you obtain teacher approval prior to, or if it is exempt, and so an area that would be exempt, like let's say you don't actually deal with the subjects that you're studying, they're being observed by teachers doing other means, that doesn't necessarily require an IRB, or that doesn't necessarily require ethical practices, because you don't yourself interact with the teacher, or you don't interact with the students, those subjects themselves. And so therefore you could cause no harm because you're not the one interfering or dictating what is told to them. You're just getting feedback from somebody else. And so that would have an exemption, and that would be just my approval as well. If it's not exempt, then you send for approval documents to the IRB, and the IRB determines risks and determines overall approval status. Here are some important exemptions. If the research is for a class assignment like this one, there are exemptions. However, our goal is that we score a 5 and that AP class, or College Board rather, publishes our material. So we want to make sure we cross the T's and dot the I's. So if they do that, we have that available. Involves nothing more than intrusive than interviewing, surveying, etc. Is not to be published. So again, our goal is to be published because we want to have the best form ever, or the best research project ever, and we want that to eventually lead to better things in the future. So we're going to follow through with all of the rules that we need. but we do have the grace of not having to do the full extent to a certain extent. All right, you still need to include safety and ethical measures in your paper, even if you don't go through the IRB process or you're exempt from the IRB because of those other things. Some other exemptions: research is in a established setting, such as, again, normal school activities. That doesn't require, because you're not, again, inflicting anything additional, you're just making observations. Individual or group behavior characteristics, ergo studies of perception or cognition, where subject's behavior is not manipulated and will not involve stress. Again, that's just simply you observing. It's not you creating something that could cause manipulation. Research in a public place involving legal behavior. So again, must be legal behavior. You're not going in and looking at some drug lord's habits in their warehouse somewhere. That's not legal behavior. It's you looking at going to some shopping mall and observing the driving habits of individuals from a car. I don't know. Research involving publicly available data. So if you got your data from somewhere that is publicly accessible, such as voting, not records, but voting parties and or voter registration, that is public access information. That is information that would not require IRB approval because it's out there for anyone to utilize. Some IRB requirements. The basic rule is that if the study involves humans or animal subjects, you need IRB. And the work will be published. Again, our goal is to obviously be published. So we're going to assume we're going to be published. And there are no exemptions. Then you need an IRB approval. You will need to submit to the IRB your application and proposal, informed consent forms. So again, any form that you're going to give to your people, your subjects rather, needs to go to the IRB as part of the approval process, and then the confidentiality agreements. Any copies of data gathering tools. So whatever the test is that you're going to be assessing them with, the IRB needs the copy of that, and any communications that you're also going to send out. All right, so I will post, so if you want more information, I'll post these again on our Schoology page or wherever we can access them until Schoology is functional for us all. But there are some extra videos for us to watch in regards to the IRB that you will have access to. And that is it for now. So we're now going to work on the assignment, which you should find either written down on the board or assigned by me prior or in Schoology. Thank you and good luck. Happy ethical researching.